Hi everybody, I'm Coach Alex. Welcome to today's video where we will show you exercise sequences for people who have knee arthritis issues. So with arthritis, or an inflammatory process in the knee joint, it is very important to firstly restore the full range of motion. That is the knee flexion and knee extension. If you still have an inflammatory process, you should work out all these exercises to the pain limit, okay? Regarding the props, all you will need is one mat and one folded towel. So for the first exercise, we will put a towel under the Achilles tendon, therefore under the shank muscle. And from this position, all we have to do, if your knee looks like this, is push the active knee downward. We will make a gentle pressure just above the knee, not on the knee joint itself, but a little up. And we will gently push the knee down. The toes are relaxed, so we do a knee extension and we slightly go back, holding 2, 3, 4 seconds, then get it back. We press a little harder, make a dozen reps, and then change the leg. The next exercise is also with a folded towel. We place it under the knee, squeeze the towel hard, and pull the knee as far as possible towards the chest. Hold for 20 to 30 seconds. Do 2 or 3 sets on each leg, and then we change the exercise. For the next exercise, we place the towel right below the knee again. Squeeze the towel strongly. Place ourselves on the soft spot, whether the couch or a bed, and try to sit behind as much as possible. We stay in position for about 30 seconds and 2 to 3 sets, and then we change sides. After we've done the exercises, or tried to do the full range of the knee joint motion, we'll now show you a couple of exercises to strengthen the structure of the thigh itself, to keep the knee joint as strong as possible. The first exercise will be performed on a high spot, where we lie on the floor. We'll just place our heels on a high spot, our toes turned to face. We will lay our heads to the floor, and from this position, we only push our heels towards the chair, where you will feel the activation of the back of your thigh and shanks. Hold for 3 to 4 seconds. Relax. Squeeze your heels firmly into a chair or couch, and then relax. If it gets too easy, we can make a variation, where we will lift the hips up from this position, hold for 2 to 3 seconds, and return to the starting position. For the next exercise, we will work on strengthening the upper thigh muscle, where we'll lean nicely on a chair, lift our legs up, turn our toes to face. Try to squeeze the muscle hard. Hold for 10 seconds, and then gently return the heel to the floor. Then we lift them again, squeeze the muscle hard, 2, 3, 4, 10 seconds, and relax. If it gets too easy, and if you have a certain weights at home, you can always put a weight on your ankle and perform identical exercise. So, the toes are positioned straight, the heel is straight, and after that we can make 2 variations where we will lightly put the toes to the side, hold the same position, squeeze the upper muscles, go back. Toes are always faced outward, and after that, the toes are faced inward. Another exercise which we will show you is for the back of our thigh, where we place the right foot just next to the left, we set the heel, lightly lift the heel off the floor, toes facing the knee, and from this position, we go gently upward. The knee of the right leg is close to the knee of the left leg. We hold it for 2 to 3 seconds and then return to the starting position. We squeeze hard, up to 90 degrees. You don't have to go all the way up. Never move your knee behind, so don't do it. You are there. We squeeze and go back. If you worked out all these exercises so far without any pain or special tensions, we can move on to the next, more advanced phase, where we'll go into a light squat with the help of a chair. The squat is performed as follows. We place our feet a little wider than shoulder width, where our toes will be slightly faced outward. They will not be parallel, but slightly outward. From this position, I'll put my hands on the chair, and you imagine we have another chair behind me. All I'm going to do with my hips is lightly lower them behind. Set in a position up to approximately 90 degrees and gently return. If it gets too difficult for you, you can always push yourself away from the chair with your hands. If the previous exercise was too easy for you, now we'll do one variation that's a little harder. And still, you can always use an outside load, a dumbbell, a certain weight, or potentially a bottle of water if you have one handy. So, we're going to put a chair right behind our feet. The dumbbell is put at the chest. From this position, we sit behind. Sit for half a second and gently get up. What matters here is that when we sit down, we must never straighten our backs too much and lean back, because we will no longer be able to get up. So once I sit down, I put my shoulders slightly forward where my spine is in a neutral position. The gravity center is closer to the floor, and now from this position, I will get up much easier from the chair. Once again, I sit down and get up gently from my legs. The last part of the exercises we do today will be on the riser, and you can do them on the stairs as well. For the first exercise, we put one foot on the riser so all the toes are against the surface. The heel is always against the surface and the outer part of the foot is always leaning. So these 3 points, the outer parts of the toes and the heel must always be leaning on the floor. The knee follows the middle 2 toes. It should never go too much inside and it should never go too far outside. The hip stays in a neutral position, and now all I do is push myself up from the front leg. So I use the back leg minimally and only for the balance. And all stems from the front leg. I get up and I slowly go back down. Once again, we will show you this from the front side. So the foot is as straight as possible, the knees follow the middle 2 toes. The hip is in a neutral position in a light external rotation, as if screwing the floor. From this position, I push myself up from the front leg. Let's do a dozen reps, 2 to 3 sets on each leg. So from the front side, it looks like this. We also stick to all the details we previously mentioned. The only thing that matters is that your knee never escapes inwards. So from this position, I keep my knee, keep it, touch it lightly, and return to the starting position. We touch firmly, we go back. What is also very important, which I didn't mention before, is that when I go forward, I never lift my heels off the floor. The heel is always against the surface. This is it for today. Thank you very much. See you in some of the following videos.